If you ever feel lightheaded right after a meal, you're not imagining it, and it's not just low blood sugar. In many people, dizziness after eating comes from a short-lived mismatch between what your gut needs and what your brain is used to getting. Eating triggers big shifts in blood flow, hormones, and nervous system signals. Most of the time it's harmless and passes quickly, but sometimes it's a clue worth taking seriously. In this video, you'll learn the most common mechanisms behind post-meal dizziness, what patterns to look for, and which situations deserve a medical check. We'll cover blood sugar swings, blood pressure drops, and why certain meals make it worse. We'll also talk about dehydration, alcohol, and a few less obvious causes. The goal is simple: help you connect your symptoms to a likely pathway so you can describe it clearly to a clinician if needed. Let's start with the fastest, most common driver: blood flow shifting toward digestion. Moving to slide 2. When you eat, your body redirects blood towards your stomach and intestines to absorb nutrients. That's normal. But if your blood vessels don't tighten enough elsewhere, your overall blood pressure can dip for a while. Less pressure can mean a little less blood reaching the brain, and you feel woozy, heavy-headed, or unsteady. This is one reason dizziness can show up even after a perfectly healthy meal. It tends to be more noticeable after large meals, very carb-heavy meals, or when you stand up soon after eating. Some people also feel sleepy at the same time because the nervous system is prioritizing digestion. Clinicians often call this postprandial hypotension, basically a post-meal blood pressure drop. It's more common with age, dehydration, and certain medical conditions that affect the autonomic nervous system, the part that automatically controls vessel tone and heart rate. The key clue is timing. Symptoms often peak 30 to 90 minutes after eating. Moving to slide 3. A related piece is how your nervous system responds to a full stomach. Stretch receptors in the stomach and signals from the gut can activate the vagus nerve, which helps regulate heart rate and blood pressure. In some people, that reflex overshoots. The heart rate may slow a bit, blood vessels may relax, and you can feel faint, sweaty, or nauseated. This is similar to what happens with vasovagal episodes, like fainting at the sight of blood, but triggered internally by digestion. It can be more likely if you eat quickly, swallow a lot of air, or go from sitting to standing right after a big meal. People sometimes describe a sudden wave, warmth, dim vision, then dizziness. The important detail is that it can feel dramatic, even when it's short-lived. If this happens repeatedly, it's worth tracking what you ate, how fast you ate, and your posture afterward. That history helps a clinician separate a vagal reflex from other causes like blood sugar or heart rhythm issues. Moving to slide 4. Now let's talk about blood sugar because it's a common suspect, but the details matter. Some people get dizzy from reactive hypoglycemia, where blood sugar drops a few hours after eating, not immediately. It can happen when a high sugar or high refined carb meal causes a big insulin response, and then glucose falls quickly. The dizziness often comes with shakiness, hunger, anxiety, irritability, or a wired but weak feeling. The timing clue is important. Symptoms often show up 2 to 4 hours after the meal, not at minute 20. Another pattern is the opposite: blood sugar rising quickly, especially in people with insulin resistance. That can cause fatigue, brain fog, thirst, and sometimes lightheadedness. Either way, the meal composition matters. Liquid calories, sweet drinks, and low-fiber carbs tend to create faster swings. If you suspect blood sugar, the most useful information is a symptom diary with timing and what you ate, rather than guessing based on one episode. Moving to slide 5. Meal composition can also change circulation and alertness in ways that feel like dizziness. A very carb-heavy meal can increase insulin and shift electrolytes, which may contribute to that drained, floaty feeling. High-fat meals digest more slowly, which can prolong the blood to the gut effect and make you feel sluggish for longer. Large meals in general raise the workload on digestion, so the bigger the portion, the bigger the physiological shift. Alcohol adds another layer because it relaxes blood vessels and can worsen dehydration, both of which increase lightheadedness. And salty foods can go either way. Salt may support blood volume in some people, but it can also make you thirstier. And if you don't drink enough, you still end up relatively dehydrated. The practical takeaway is to look for patterns. Is it worse after big portions, after sweets, after alcohol, or after meals with little protein and fiber? Those patterns point toward different mechanisms, and they're useful when you talk to a healthcare professional. Moving to slide 6. Hydration sounds basic, but it's a major amplifier. If you're even mildly dehydrated, your circulating blood volume is lower. Then when digestion pulls blood toward the gut, your brain may feel the drop more. Dehydration can come from not drinking enough, heavy sweating, vomiting or diarrhea, or simply lots of caffeine without enough water for your body. Another overlooked factor is electrolytes. Sodium and potassium help regulate fluid balance and blood pressure responses. People sometimes notice dizziness after eating when they've been busy, skipped fluids, then suddenly eat a big meal. The meal isn't the only trigger, it's the context. A simple clue is dry mouth, dark urine, or feeling better after fluids and rest. That said, dizziness has many causes, so hydration is not a universal explanation. Think of it as a volume knob. Dehydration turns up whatever underlying mechanism is already there, whether that's blood pressure dips, blood sugar swings, or vagal reflexes. Moving to slide 7. Sometimes the dizziness isn't from blood sugar or blood pressure at all. It's from the inner ear or migraine pathways being triggered around mealtimes. Vestibular issues can cause a spinning sensation, imbalance, or nausea, and symptoms can flare when you're tired, dehydrated, or after certain foods. Migraine doesn't always mean a severe headache. Some people get vestibular migraine, where dizziness is the main symptom, and food triggers like alcohol, aged cheeses, or irregular meals can play a role. Another clue is sensitivity to light, sound, or motion, or a history of migraine. Reflux can also mimic dizziness by causing chest discomfort, throat tightness, or a floaty sensation that's really from breathing changes and anxiety. The key is the quality of the symptom. True spinning, rocking, or motion sensitivity points more toward vestibular causes than simple lightheadedness. If your dizziness feels like the room moves, that's a different pathway than a blood pressure dip. Moving to slide 8. There are also medical conditions where post-meal dizziness is a known pattern. One is autonomic dysfunction, where the automatic control of heart rate and blood vessel tone is less stable. People may notice dizziness with standing, heat, showers, or after meals. Another is anemia. Low oxygen carrying capacity can make any blood pressure shift feel worse, especially after eating when blood is redistributed. Thyroid disorders can affect heart rate and energy, which changes how you tolerate meals. And in people with diabetes, both high and low glucose episodes can happen, plus nerve changes can affect blood pressure regulation. Certain medications can also increase the chance of dizziness after meals, including some blood pressure medicines and drugs that affect heart rate or hydration. The point isn't to self-diagnose. It's to recognize when the pattern is frequent, worsening, or paired with other symptoms like palpitations, shortness of breath, chest pain, or fainting. Those combinations deserve professional evaluation. Moving to slide 9. If you want to get practical, focus on 3 things you can observe: timing, posture, and meal type. Timing tells you which system is most likely involved. Minutes suggest blood flow or vagal reflex. Hours suggest reactive blood sugar. Posture matters because standing right after eating stresses blood pressure control, while symptoms that happen even lying down can point elsewhere. Meal type matters because refined carbs, alcohol, and very large portions are common triggers. If you have a home blood pressure cuff, you can record a reading before eating and again at 30 and 60 minutes, especially if symptoms hit. If you use a glucose meter for medical reasons, timing your readings to symptoms is more informative than random checks. Also note associated symptoms: sweating, tremor, nausea, spinning, blurry vision, or a racing heart. This kind of simple log, just for a week, often makes the story much clearer for a clinician and helps rule in or out the main pathways. Moving to slide 10. To wrap it up, dizziness after eating usually comes from one of a few buckets: blood pressure dipping as blood shifts to digestion, a vagal reflex that overshoots, blood sugar swings that happen later, or triggers like dehydration, alcohol, migraine, or vestibular issues. The most helpful thing you can do is connect your experience to a pattern: when it starts, how long it lasts, what it feels like, and what meals make it worse. If you ever have severe symptoms, fainting, chest pain, new neurological symptoms, or repeated episodes that are escalating, that's a good reason to seek medical evaluation. If you found this breakdown useful, subscribe for more calm, mechanism-based explanations of common symptoms. And for a quick check-in, comment with your pattern. Does your dizziness hit sooner, within an hour, or later, 2 to 4 hours after eating? This information is not a substitute for medical advice. Moving to slide 11. If you feel dizzy after eating, it's often not random. It's your body shifting blood flow, pressure, or blood sugar. The timing is the giveaway. Within an hour often points to blood pressure or vagal reflex, while 2 to 4 hours later can suggest reactive blood sugar changes. Big meals, refined carbs, alcohol, and dehydration can all make it worse. A simple 1-week log of timing, meal type, and symptoms can make the cause much clearer. This information is not a substitute for medical advice.